Hi, I'm Dr. Charles Schnee, a board-certified neurosurgeon at MedStar Health. I specialize in general neurosurgery, spinal surgery, including minimally invasive and microsurgical techniques. So I've been in practice for many years. I treat a number of spinal conditions. Many are degenerative, meaning they're acquired with age, time, fatigue to the body. Common things would be problems with spinal discs, instability of the spine, deformity and scoliosis, problems related to osteoporosis, and other degenerative spine conditions. Many spine conditions really cut to the core of what makes us human and what allows us to have a good quality of life on a daily basis, such as the ability to walk and use our arms and legs without pain, our ability to sleep comfortably, to work, for older people to interact with younger family members, for people to have intimacy, and also bathroom functions, so some really critical things. And if you have a derangement in these functions, if you're having pain, if you're having numbness, if you're having weakness, if you're having loss of function, you should bring it to the attention of your doctor so you can get it checked out. It's always better for the patient if we can employ a surgical technique that is minimally invasive or microsurgical. In practical terms for the patient, it's a smaller incision, it's less tissue retraction, so less bruising. More often than not, it's less post-operative pain, a faster recovery, shorter hospital stay, often outpatient surgery. Patients can get into physical therapy faster and can resume their normal activities faster. One of the surgical approaches that I employ, and I'm very excited about, is the minimally invasive lateral approach to the lumbar spine. It is a fusion surgery, but it's a way to access and stabilize a spinal level without opening the back, without dissecting the back muscles, and in many cases without screws and rods. The lateral approach can be used for degenerative conditions. It has a great application in patients who've had previous surgery. It can be used for deformity. It can be used for some infections and trauma patients. I think one of the best changes that we've seen in spine surgery is we now understand how important it is to get people up and moving at the earliest opportunity, to work with them so they have less pain, and to employ techniques that allow them to mobilize sooner and resume normal functions at the earliest opportunity. It's very gratifying when a patient comes back after surgery and after they've participated in therapy and had time to heal, and to hear from them how they're able to resume important family and life activities that are important to them, whether it's being involved in a child or grandchild's life, getting back to work and feeling productive, or resuming a more normal relationship with their partner. One of the basic goals of spine surgery is to help patients have less pain. So it's particularly gratifying when a patient comes in and says that they are able to reduce the use or eliminate the use of pain medication, and they can resume activities without pain. Many years ago, when I chose my specialty, I asked myself, what is the most important thing that defines us as people, as human beings? My answer was the nervous system. It motivates me every day to come to work to help people try to restore the functions that I perceive to be the most important.